What is the most common cause of knee pain in runners? The most common cause of knee pain in runners is actually something called patellofemoral pain syndrome. And it's also known as runner's knee, which, makes sense because it's common in runners. Patellofemoral pain syndrome happens when the patella, or the kneecap, doesn't run normally in the groove that it sits in on the thigh bone. This typically we diagnose just based on what the patient tells us and on our physical exam. If we get an X-ray or an MRI, it's going to look normal because those tests don't measure the irritation on the back of the cartilage. One thing that we can do to determine if someone has patellofemoral pain syndrome or if that could be contributing or if they're at risk for it is to have them do a single leg squat. So we have them stand just on one leg and try to bend the knee. If their knee goes straight over the toe, that's exactly what we want to have happen. Most people, because they have weak quadricep muscles and weak hip abductor muscles, which are the ones that help you stand on one leg, because those muscles are weak, their knee dives in. And when your knee dives in, the kneecap doesn't have a straight groove to run in, and it can irritate the back of it. And that's what contributes to patellofemoral pain syndrome. So you imagine, every time we go for a run, we're doing thousands of single leg squats, step over step over step. So even if you're pretty good at one single leg squat, by the time you get to 1,000, 5,000, 10,000, you might be fatigued. And that kneecap is running and rubbing on the backside of your thigh bone. The typical treatment for this is working on strengthening of the quadriceps and the hip abductor muscles, stretching the quadriceps out, and making sure that every time we run, we step, we squat, we're going in a straight line with that kneecap running directly on the thigh bone in a normal manner.